Hey everybody, Dr. Hampton here. Quick question. Have you ever looked down at your skin during an eczema flare and thought, wow, my immune system is being extra today? Because eczema can feel personal, like your skin woke up and chose violence. And today's video exists because of someone I really respect, DeNitra Davis. DeNitra reached out to me and said, Doc, have you done a video on eczema? And I realized I haven't. So DeNitra, this one is for you and for the people you're coaching. DeNitra also has her own YouTube channel at Advocate Coach Educator, and you should absolutely check her out. And at the end of this video, I'm going to link my Protecting Your N.E.S.T interview with her as an end screen, because her story is powerful and practical. Now, let's talk about what most people miss. A lot of folks treat eczema like it's only a skin problem. Like the solution is just to find the right cream, the right soap, the right detergent, and of course the right prayer, and maybe a new set of sheets blessed by angels. But eczema, especially atopic dermatitis, the most common kind, often behaves like a whole body inflammation issue that's showing up on the skin. And here's the key idea for this channel. When you improve your metabolic health, you're not just losing weight or lowering sugar. You're changing the inflammatory environment your body lives in. And that can matter a lot for eczema. Let me explain it this way. Eczema is basically a situation where your skin barrier is leaky and irritated. Your immune system is overreacting, and your itch-scratch cycle turns into a full-time job. And it's not random that the person with eczema is often the same person, or in the same family line, who deals with allergies and asthma. That's what we call the atopic triad or atopic march. Eczema, allergic rhinitis, and asthma tend to cluster together because they share immune pathways. Same immune wiring, different symptoms department. So if you can calm the immune system and lower the baseline inflammation, you're not just chasing symptoms, you're tugging on the root cause levers. I think about eczema using 4 big drivers. Number 1, the skin barrier. Number 2, the immune system and inflammation. Number 3, the microbiome, skin and gut. Number 4, the metabolic environment, insulin resistance, obesity risk, and the inflammatory noise that comes with it. Let's go through the metabolic piece, because this is where many people's minds get blown. We now have a growing body of evidence showing connections between obesity and atopic dermatitis. And the relationship appears to go both ways. The conditions share features like systemic inflammation and insulin leptin signaling issues. Now, does that mean eczema is only caused by metabolism? No. Genetics, environment, allergens, stress, infections, those all matter. But it does suggest something important. If your body is marinating in chronic inflammation, driven by ultra-processed food, frequent glucose spikes, poor sleep, high stress, and insulin resistance, your skin may be one of the first places that inflammation shows up, because your skin is not just a cover, it's a living immune organ. Here's a mechanism that's easy to understand. When blood sugar runs high, proteins and fats can get sticky through a process called glycation, which forms advanced glycation end products, abbreviated AGEs. AGEs can amplify inflammatory signaling through receptors like RAGE, which is basically receptor for advanced glycation end products. And researchers have explored these pathways in inflammatory skin conditions, including atopic dermatitis. Translation: if your metabolism is inflamed and your blood sugar is on a roller coaster, your skin can pay rent in that neighborhood. And then there's the gut-skin axis. More research continues to support that the gut microbiome and immune signaling can influence atopic dermatitis, meaning the gut can coach the immune system in ways that show up on the skin. So when someone tells me, Doc, my eczema improved when I changed my diet, I'm not shocked. Because for many people, changing diet changes insulin and glucose variability, systemic inflammation, microbiome inputs, nutrient density, and the immune system's tendency to overreact. Now, this is the part where somebody in the comments is going to say, so what, Doc? Are you saying keto or carnivore cures eczema? No, I'm saying this. For some people, these approaches can be a powerful therapeutic trial because they remove the most common inflammatory drivers, especially sugar and ultra-processed foods. And they simplify exposures so you can identify triggers. And I'll also say this, even dietary intervention research in atopic dermatitis is still evolving, and the quality of evidence varies by intervention and population. So what do you do with that? We act like clinicians. We treat this like a structured experiment. Here's the eczema reset plan I want you to consider. Step 1, start with the basics that work for almost everyone. This is not glamorous, but it's foundational. Gentle cleanser. Short, lukewarm showers, not the boil the demons out setting. Moisturize consistently, especially right after bathing. Avoid fragrance-heavy products. Wear soft, breathable fabrics. If you do nothing else, do that. Step 2, scan for red flags. If eczema is suddenly worsening, spreading fast, crusting, oozing, painful, or you have fever, think infection. That's medical care territory. Also, if you're not sleeping because you're itching all night, that's not just skin. Sleep deprivation worsens inflammation and insulin resistance. And it also wrecks quality of life. That's worth escalating. Step 3, lower the inflammatory load, starting with sugar and ultra-processed foods. This is where metabolic health enters the chat. If your diet has sweet drinks, desserts, so-called healthy snacks that are basically candy, constant grazing, seed oil heavy ultra-processed meals, then your skin may be catching the consequences. A practical move, run a 21 to 30-day trial where you remove added sugars, refined grains, industrial seed oils as much as possible, ultra-processed foods, and you replace them with whole protein-forward meals, non-starchy vegetables if you tolerate them, and fats that keep you satisfied. For many viewers on this channel, that naturally turns into low-carb or keto. And for some, a carnivore-style elimination phase can be a clean way to reduce variables, especially if they suspect multiple food sensitivities. Step 4, identify personal triggers. Don't guess, test. Common culprits for some people include dairy, eggs, alcohol, high sugar salsas, certain additives, dyes, or preservatives, high histamine foods in some cases. But I don't love random restriction. I prefer a structured elimination and reintroduction so you learn your body. Step 5, don't forget the non-food drivers. Eczema flares love chronic stress, poor sleep, overheating and sweat friction, harsh detergents, indoor dryness. And stress isn't all in your head. Cortisol and adrenaline change immune behavior, glucose patterns, and skin barrier function. Your nervous system can absolutely turn the volume up on inflammation. Step 6, use medicine appropriately when needed without shame. I'm a root cause doctor, but I'm not anti-tools. Sometimes you need prescription topicals. Sometimes you need allergy management. And for moderate to severe cases, dermatology-guided therapies can be life-changing. Root cause work and symptom control are not enemies. They're teammates, especially when the goal is to stop the itch-scratch cycle while you fix the terrain underneath. So here's the bottom line. Eczema isn't always just a skin problem. It's often a sign your immune system is reactive and your barrier is compromised, sometimes in the context of a higher inflammatory metabolic environment. And the good news is, when you improve metabolic health, you often improve more than the skin. You're tugging on the same web that connects eczema with allergies and asthma risk. You're lowering systemic inflammation. You're changing the internal conditions that make flares easier to trigger. So if you've been stuck in the cream flare cream cycle, consider stepping back and asking the bigger question. What is my body reacting to? And what can I change upstream? And before you go, 2 quick things. First, check out DeNitra Davis at Advocator Coach Educator. She's doing important work, and she's the reason this topic is on the channel today. Second, stay for the end screen, because I'm linking my Protecting Your N.E.S.T interview with DeNitra so you can hear more of her story and how she thinks through metabolic health. And if you want a simple next step after this video, start by removing sugar and ultra-processed foods for 21 days. Tighten up your skin routine and track what changes. Your skin may start telling a different story. I'll see you in the next video.